Just before we start, I just wanted to make you all aware that this session does contain discussions of subjects that may prove upsetting for some attendees, including references to abuse and violence. Details of local support services will be signposted during the session for anyone affected by the topics discussed. Please ensure your microphones are disabled. You're welcome to leave your cameras on if you want to engage in the session, but of course are welcome to leave them off if you'd rather. So your team supporting the event today are myself, Alex Ridley. I'm one of the Workforce Programme Managers in Integrated Care Northamptonshire, and we've got Sarah Good joining us, who is one of our learning development facilitators based at Northamptonshire Healthcare Foundation Trust. As I said at the beginning, please ensure your microphones are turned off just to ensure that the session, everyone can hear the session. You're welcome to leave your camera on if you wish to do so. We are recording the session and an audio transcription will be available following the event. If you've got any questions, please do pop them in the chat or use the raise your hand function, and we'll try and get to as many questions as we can at the end of the session. So I'm delighted to introduce you to Natalie Highland from Northamptonshire Healthcare Foundation Trust to lead today's session. Over to you, Nat.
Hello, thank you for inviting me here today to talk about women's safety. So my name's Natalie, everyone calls me Nat. My background's mental health. I've been with the Trust for 26 years this year. And alongside being an RMN, I'm also what's called a PMVA instructor, and that's the Prevention and Management of Violence and Aggression. And I teach full-time within our team. Next slide, please. So I wanted to include a trigger warning, again, just to let everybody know this session does contain subjects that may prove upsetting, including references to abuse and violence. And it's important that we have these conversations, but if you or anyone you know has been affected by any of these topics, we are going to put some support phone numbers within the chat and just also towards the end of this presentation. So the first 3 slides are quite difficult, but then we'll move on after that. Okay, next slide, please. So why are we here? Why are we having this conversation? Well, this conversation came about following the sad death of Sarah Everard, and there are some uncomfortable truths around this death, sadly. And even since the death of Sarah Everard, in the 28 weeks following that, a further 81 women were also murdered. In the same week that Sarah was killed, a young lass named Sabina Nessa was also killed in very similar circumstances. But nobody seemed to be talking about Sabina. So the argument then was, well, Sarah was murdered by a serving police officer. Well, since 2009, Sarah became the 16th victim to be murdered by a serving or former serving police officer. Now, you'd probably say to me, well, that's a bit harsh. This isn't about sort of knocking the police and the job they do. It's a very difficult job, but it's about becoming aware of the risks. And also, in the same time frame between 2009 and 2019, 52 women were murdered by either British Army soldiers or former Army soldiers. So again, 2 big institutions there that we think are there to protect us actually have some issues of their own and we need to look at. And again, when we talk about Sabina, it's important to remember whenever we're talking about women's safety, and I mean all women, if you belong to a protected characteristic, such as, you know, BAME or LGBTQIA or age, actually you have a higher risk of being on the receiving end of violence, abuse or aggression. This next slide is slightly tougher, so can we have the next slide, please? Now, sadly, women are more likely to be killed by those closest to them, by someone we know, and at least 32% of those are by partners or by ex-partners. It's only in 5% of cases where it's a stranger. When we're looking at homicide rates, actually more men are killed annually than women. Women tend to be killed in their own homes by someone they know. Men, the inverse is true. So it's always important to remember that this isn't a conversation about all men are bad, but this is about the risks we face in the light of violence. Violence and aggression are equal opportunities offenders. So it's always important to remember that it doesn't matter your gender or your sexuality, that are going to be risks around that we just need to be aware of and mindful of. The next slide is quite difficult. So can I have the next slide, please? Sadly, when we look at reported incidences of rape and sexual assault, those numbers are climbing and have been climbing steadily over the last 10 years. Now, when you look at the Office of National Statistics, when they reported incidences of rape and sexual assault in 2020, they recorded it of just under 40,000. But when you look at the CPS statistics, it's actually more higher at 52,000. What the discussion around that so far I've heard is that people are saying, well, there's a lot of legacy crimes coming forward, so things that happened many years ago. It's only now people are feeling safer to come forward. And I think it's good that people are coming forward and reporting it. It's really important that we do talk about it and are aware of it. But it's always remembering that, you know, stats can sometimes not give us the full picture. And whilst we're looking at these figures, and it did feel horrible working through them, it's also worth bearing in mind there are 33 million currently in the UK. So even though these numbers feel really massive, there is a statistical issue there around the percent chance of being assaulted. But it's important that if anything happens, that you do share it and you do get some support. So can we have the next slide, please? One of the things I was asked to talk about is lone working. Having spent many years in the community myself, I understand how difficult that can be for us at times. But lone working is not just about working out of your own car. There are also customer facing roles. So people who sit behind a reception, perhaps, or looking after a clinic, perhaps you're on your own towards the end of the day. It's about making sure that you and your manager and your employer give consideration to your safety and ensure you have a means of communicating with others if something starts to go wrong. Do you have a covert panic button? If there is an alarm system, how do we know how it works? Who tests it? Who knows how to respond to it? Do they know what it sounds like? All those kind of things are discussions you need to be having in your base of operations. Make sure that any cash you have is kept out of sight. And there are a lot of disclaimers in Windows these days saying that no funds are kept behind this desk at all. So it's important that anything like handbags or anything of any worth is put away and out of sight from any sort of passing opportunist. Given that women are more risky when they're working from home, it's actually important that you don't advertise the fact that you're working from home and set up a buddy system. You know, maybe call you 10 minutes into a meeting or towards the end of the day to make sure you're okay, just check in. Some of my colleagues are counsellors and they work from home. We've talked endlessly about their safety, and if somebody is going to come to your house, you make sure you use a room that doesn't disclose any personal information about you, and that there are exits that you can get out of if you need to. And if you are going to be at home, it's about what systems do you have in place that are going to keep you protected. Can I have the next slide, please? So lone working when we're out and about, it hasn't really changed at all much over the years, you know, even back from the early 90s. But do first of all, give some thought before you even start to go on your visits, whether that be clinical, healthcare, you know, social work, nursing, mental health, general health. It's really not important. The thing is about having that conversation with your team. Talk to each other about what exit strategies you might already have and you could use if you felt uncomfortable. Get a list of excuses ready and prepared before you go out, because if you want to get out of that place quickly, you're going to need those excuses. And make sure that your handovers are robust enough. If there are issues around the place you are going, you will understand and know those risks. And if it needs to be a two-person visit, look at how you can plan that into your shift. There's a point here I want to make about lanyards. I have a particular dislike of lanyards. Now, in mental health, we tend to wear 3 break lanyards, and they're particularly useful because if somebody tries to grab them and take you by the neck with one, they actually snap quite quickly. But I do see a lot of my colleagues walking with the older fashioned lanyards and even going around places like Sainsbury's with a lanyard on. If you're going to wear a lanyard, only wear it when you're in the office. And even then, I'd probably have my ID either as a badge or in my pocket ready to present if I needed to. When you're going out and about on your visits, remember to conduct your own risk assessment on the doorstep, even before you go into the property. So if you do start to feel uncomfortable as that door opens, you're ready to make an excuse to move. And trust your instincts. I can't, emphasize this enough. If you start to feel uncomfortable, work with it. Be mindful of the fact that you are going into someone else's territory if you're doing a home visit. And your presence may be seen as an unwanted or poses a threat. And it may not be the person you're working with that feels that way, but maybe the other people that are in the home. Don't just do a risk assessment of the patient. Make sure it's of the property, of the people in there, in keeping yourself safe. And if you do feel unsafe, making sure that you share that with your team so it can go on record, so you can look at how you're going to work with this person as we move forward. As you enter that unit, that building, that flat, house, bungalow, whatever it is, make sure you take a note of how that door opens. And also be aware of whether it's a short alleyway. A lot of the Victorian houses we have, the terraced houses, have very narrow hallways. So you need to be looking for where your exits are and keeping those doorways clear, you know, so that if you need to make a quick exit, you can. Always tell the person how long you're going to be there for, however long this is going to take place, whether that's a dressing or a psychosocial kind of assessment, and stick to the time frame. Sometimes we like to get chatting to our patients and we get delayed, or it may be that things change and you've got to take a different approach to the session that you're running, but make sure that you stick to that time frame as much as you can. And it's really important that your base of operations have some kind of tracing system so that whoever's the nurse in charge or whoever's looking after the shift or whoever's there is able to track you and know where you are. Risk assessments should be carried out by your employer to identify any risks related to the people, the environment, or the tasks involved in your job. We risk assess constantly throughout the day, don't we? We do it with ourselves, even when we cross the road. And sometimes we can get a bit relaxed about it and not think about it. It's really important that you have that conversation with yourself to make sure that you feel safe. You need to be able to make your own risk assessment as well and help you decide how to feel safe in a situation and what action you're going to take if you want to avoid danger. So take care of yourselves whilst you're out there. And again, this isn't, you know, make sure you check your lone worker policy, have a read of the violence and aggression policy. I know that everybody says, you know, read the policy. There's lots of policies to read, but just try and make time for yourself. And if you can, if you're going to have a team meeting, bring it into the discussion just to keep each other safe. Next slide, please. So there are lots of personal alarms out there from you, ranging from the extremely cheap, such as the keyring sound alarm, moving all the way through to something all singing and all dancing. You need to decide which sort of alarm is going to work for you best if you want to carry an alarm, but it's only going to be one part of your safety plan. You'd never become over-reliant on alarm. Now, if you use a sound type alarm, it really needs to be 138 decibels. And what you do there is, if it's got to be loud enough so it shocks your attacker, so it gives you a couple of seconds to be able to, you know, escape and make your exit. It's got to be easy to use and easy to set off in one hand. And is it one of those ones where you push against another person, you can activate it? And think about whether it's fiddly or not. Is it push? Is it pull? Is it a pin out button? Is it fiddly? If you have an issue around, you know, your hand mobility, maybe you need to think about a different type of alarm. There's also things like sprays and dyes you can squirt towards your attacker. And these are quite useful. But again, it's how are you going to carry that? Is it going to be in the bottom of your bag? Are you going to be able to operate it quickly? And even moving all the way through to being tracked throughout your day, you can have a tracker system. The all singing, all dancing lanyard there in the corner is it's what it does is it's GPS tracked, but it has like a one-way phone in it. You record where you're going, you say that what you're going to do. When you get into the property, if you feel unsafe, you can press the panic button and somebody can start listening straight away. Then they can ring you. If it does get more worse than that, you can actually take it off, pull the lanyard off it, drop it, and then the person on the other end will ring the police. Now, for a pocket alarm, you're talking anywhere from a few pounds, but for the personal safety lanyard, you're looking at somewhere of £150 to buy it, and then you have to pay a monthly subscription fee so that you can have the other services around that. So it's important to just have a think, maybe something that would work for you better. A personal alarm is just one part of your personal safety plan, and there are other tools out there. This is just a few ideas that you could think about or consider whilst you're out and about. Can I have the next slide, please? So when I was growing up, the focus was on self-defence classes. And personally, if anybody asked me about doing a self-defence class, I'd say absolutely do one. The worst case scenario is you're going to get a bit fitter. So do. But these days, smart technology has been really, really useful. A lot of these apps can be downloaded onto your phone and they're free. Sometimes there's a subscription rather if you want additional features, but again, a lot of them are free. So Be Safe currently is one of the most popular when you look at iOS and Android, and that can be activated through touch or voice commands, and it does have SOS buttons that will not only call for help, but also record audio and video. It will even contact your friends or secure people to contact just to give them an update of what's happening. And there's a fake call feature. Hollyguard, again, this is another popular one. The idea is if you feel in danger with a simple shake or tap, it activates and alerts. It has two modes, which is deterrent or stealth. With deterrent, it will make it clear to anyone in the area that you've sent an alert. And the second shake, the phone will generate a high-pitched alarm and a flashing light. Something like Walk Safe uses police data, and this personal safety app alerts users when they're entering high crime zones. You know, when you're out and about in your car going from visit to visit, sometimes you don't know what areas you're going through. So by using that and pinning locations, the app refreshes the map twice a week. So as well as police reports, the app allows users to post live updates as well when they feel unsafe in that area. So it's a good way of staying informed. And there's a tap safe feature on that. So that there are two options. So if you can choose OK, it requires you to tap the phone every 30 seconds. But if you feel nervous, you need to tap it every 10 seconds. If you fail to reach your destination on time, it will notify your preferred list of contacts to let them know that, and also to keep you safe. The red panic button is very simple. It's one of the easiest ones out there. And it works by simply pressing the red button on the app, and it will instantly send your location and Google Maps via email or SMS to your emergency contact. It will also send out a panic tweet. It does share your location and lets your followers know you need help. Now, they found the red panic button very useful for medical emergencies, lost children. I mean, even taxi drivers and HGV drivers are using this. So there's situations where hitting that red button could bring help. One Scream, again, is quite popular. We all take our phones out with us, and in some situations, we might not have the time to take the phone out. But the One Scream app is based on AI, and it detects a panic scream and it activates an alarm on your phone with a loud siren. If you don't cancel the alarm within 20 seconds, it sends an automated call to your nominated contacts. What they have said with this one is that if you're a man, it won't pick up the scream, or if you're an older adult. So all of these apps can be used by anybody. Life 360, again, is another personal safety one and used as a GPA phone locator and tracker. You can use this, homeschool, and follow each other about to make sure you're okay, and there is a help alert attached to this. But KiteString doesn't need a smartphone. It's actually just a free text message service. It requires minimal information to set it online. You don't even need an email address for that one. So if you do decide to go out, you simply text KiteString for how long you'll be out, and then it starts texting you. So again, you know, as technology moves on, we sort of continue to grow with that. So I think it's really important to keep your eye out on things that are happening. Can I have the next slide, please? So always remember the phrase relate. What to do if you feel unsafe or try and remain calm. I know people can say, well, that's a bit much. It's not very good. However, what I would say is if you're starting to feel you'll get that rush of adrenaline, it'll be fight, fright, freeze or flop. Please breathe, taking some deep breaths, let them out slowly. Don't let them out as a sigh, and leave the environment. If you start to feel at risk, leave. Raise the alarm, whichever one you have, use it, and then tell someone what has happened as soon as you can. And if you're in an emergency situation, do contact the police. You know, I've been on home visits that have started to get very difficult quite quickly. So it's important that we remember that and think about how we're going to get out of here and keep ourselves and each other safe. Can I have the next slide, please? One thing I did want to mention was the talk of running safely. You know, a lot of my colleagues and my friends do run, and it's really important that you just take a few minor safety precautions just to keep you safe. We shouldn't have to do this, I know that, but again, it's just a few bits that can help keep you a little bit safer. So let someone know how long you're going to be out running. Don't be tweeting that you're just about to go running. I'm not a fan of putting on any social media where I am or what I'm doing personally. That's down to you. I know some people really like that, and that's great, but do let someone know where you're going. Consider download one of the safety apps or even a running tracker app so a friend can keep an eye on you. But plan your route beforehand. Is it going to be busy? Is it going to be well lit? Do you run to the fields? How do you run? Where do you run? And maybe joining a running group. I know a lot of people like to run alone because it helps them, helps mindfulness and process the day, but sometimes it's good to run with others. Think about carrying an alarm or even one of the apps on your phone, because what you're going to do is want to get distance between you and a possible attacker if need be. I know people like to run with music in, that's fine, but maybe run with just one earphone. And if you're running when it's dark, think about a torch option. And some of my friends run with head torches. It's a great way of keeping your hands free if you need them. If you're running in the dark, thinking about wearing reflective clothing, and also carrying a small amount of cash or your card to enable you to get home safe if you need to. If you feel uncomfortable or at risk, always seek a place of safety, a shop, anywhere without other people, and tell someone what is happening. We plan for the worst, but we always hope for the best. And I think it's really important that we just take care of each other. Next slide, please. Now, I did want to give a nod here to Northampton Police because they set up Operation Kayak, which was about women's safety in Northampton. There are 4 key strategies this year, I think, apart from drug harm and a couple of others, but women's safety was important to them. And I think it's also too important to remember that we do like to go out and have fun. And it's important that we take care of each other. So Operation Kayak is about uniformed officers undertaking hotspot patrols on a Friday and Saturday night and on student nights to help reduce offending, safeguard the public and protect against that sexual aggression, harassment and inappropriate behaviour. So since it began, Operation Kayak have arrested 9 men for sexual offences. They've also provided 200 vulnerable people with support and safeguarding. And you'll see, and if they see vehicles loitering around either Northampton or Kettering, they will actually pull them over and see if their reason for being in the area is valid. It's been quite successful to date. It's also worth remembering that, even if you go to the pub, it's important that you keep an eye on what you're drinking and how you're drinking it and looking after your drinks, not leaving them unattended. Don't take drinks from strangers. That kind of advice hasn't changed in a long time, but there have been some spikes in Northampton where certain areas, there's been an increase in drink spiking rather, and people being drugged. There's one specific area, which I would advise everybody to stay away from. But again, you can even buy coasters yourself that you can pop on top of your glass to keep your drink safe. And in some cases, some coasters say they change colour if the drink has been tampered with. Now, I can't honestly find any information to back that up, but it's also worth covering that drink up. And keep an eye on each other and have a plan for getting home safely. A friend of mine was at a festival recently. They noticed a young girl on her own who was intoxicated. They stayed with her, they got security to her, got her off to first aid. It only takes 10 minutes out of your time just to look after somebody. And if you have any concerns about anybody's well-being or behaviour, you can report it to the venue staff or to the police. And don't forget, a lot of pubs now run the Ask Angela scheme. So they're really important in maintaining our safety. Another point I wanted to make here as well is if we're going out and about, we might also be going on a date. Well, don't forget, if you start a new relationship, there's such a thing called Clare's Law. Now, this gives any person of the public the right to ask the police if their partner may pose a risk to them. And it's often called Clare's Law, after the landmark case that led to it. This scheme allows any member of the public to make an inquiry into the partner of a close friend or family member. If you have any suspicions that the person you may be starting to date could have a history of domestic violence, you can ask for that. Can I have the next slide, please? Now, sadly, we do have to talk about, as a lone female, being stopped by a single police officer. The Met and other police forces gave lots of information to people following the issues around Sarah's untimely demise. And there was a lot of discussion, I'd say, online around whether it was useful or not useful. But there are some things we can do. So if you're alone, politely resist arrest and refuse the handcuffs. Ask the person, the officer, where are your colleagues? Where have you come from? Why are you here? Why are you stopping me or talking to me? And additionally, the force says that if the officer has a radio, you can ask to speak to the operator in the control centre. Ask for a female officer or 2 other male officers to be called. And if this is denied, you can ring 999 and submit the request yourself. Don't get into a vehicle until other additional officers arrive. And if there are no additional officers available, request the officer walk with you in public to the nearest police station. What they do say is if you are signalled by a lone officer in the car, you can drive to the nearest police station or busy public area. It's always worth noting whether you live in Northampton or in Kettering, where your nearest police stations are, should you need to get to them if you want to. Can I have the next slide, please? So there's specific support out there if you need it. We're going to put these support phone lines up in the chat just in case you need them, or it may be a friend of yours might need them, but it's always worth remembering that is support out there so that you can get help if you need it or someone else needs it. And can I have the last slide, please? So take care of yourself and each other. If you're out and about on visits, think about the amount of things you're carrying. You know, are you carrying a laptop bag, a handbag, a lunch bag, a travel mug, a phone, keys? You know, think about what you're carrying with you. Think about what you can ditch in an emergency. There is lots of technology out there. You know, have a look, see what you feel, share it with your friends, have a discussion about it. You know, when you get together, always trust your instincts, go with your gut feeling, and stay safe. Thanks for listening.
Thank you, Nat. That was a really insightful presentation. Oops, sorry, I'm jumping the slides around now. So obviously, as we've talked about earlier, there are some resources that Nat's provided. If you have been affected by any of the other information provided in this video, we've just got some links on screen that you can access. So Nat, I just wanted to ask you, you talked about the Ask Angela scheme. Could you just explain to people on the call what that involves, please?
So if you're out and about, you're in a pub, you know, if you feel under threat, if you think your drink's been tampered with, if, you know, you're being harassed by somebody you don't want to be harassed by, you just go to the bar and you ask for Angela. It might be you need to make a quick exit because the person's targeting you. If you go to the bar person and ask for Angela, they will understand immediately what it is you need to do, and they will get you somewhere safe and get you protected. And that's either getting you on your way into a taxi or removing the other person and keeping them distracted whilst they keep you safe. That's been going for a couple of years now. I know that it's quite popular. I went into, well, the last time I went into a pub, I thought, well, I'm going to see if this works, and I was going to ask, is Angela about? And it was immediately, I had 3 bar staff coming to support me. It was just like, oh, yeah, I just wanted to check you knew what I was talking about. I apologise. But again, they were really switched on. So, you know, it's important that we're aware of these things. And again, there are other, you know, different counties have their own version of it. It's well worth checking in if you have a regular or a local and having a word with them to see what they do.
Yeah, that was one of the questions, actually, if it differs across the counties. But I know certainly in Northamptonshire, I've seen it in the back of toilets and things, isn't it, as you go into pubs and things. So, as you say, certainly worth looking out for. So we've had lots of comments coming through on the chat, you know, about some of the information you provided, the apps particularly, about things that people just don't even realise are out there. There's a couple of people just asking where the nearest police stations are, and I know somebody's put on here about Corby's closed. I don't think Kettering is particularly full time any longer. How's the best way to find out where your nearest police station is?
You can either hop on to the police website, what is it, Northampton Police, NPCC or something, I think it is, and have a look on their website. They do have, I know that there's a lot of clinics, so places like Desborough, which I know quite well, other places will have clinics every week, so if you wanted to check in there, whichever area you're in will have their own PCO dedicated to that area, so it's always worth having a chat with that, and you can find that out on their website. And again, they'll let you know. Yeah, part-time police stations are fairly relevant now, but it's always worth noting roughly when they're open and whereabouts they are. So just hop onto their website, that will tell you.
Thank you. We've had a question, which probably is more for our support team, to be honest, about sharing the contact details, which I'm sure we can look at the attendee list and cascade the contact details at least. Gemma, some of the stats that were shared by Nat on the call are available on are readily available, I think, on websites. Lovely. So I don't think we see I've got any more questions in the chat, unless anybody wanted to jump in and ask a question of Nat. No, that seems okay. Lovely. Thank you again for your time, Nat. So for people that are still on the call, as you know, we do like to gather your feedback. So we'd be grateful if you could just take a minute of your day just to send some feedback on today's session. We've got a QR code available on the screen now, or there'll be a link popped in the session chat for you to fill in the feedback form. And as ever, we will enter every submission into our prize draw. We've also got lots more resources on our Wellbeing Festival website, which the link is on the screen, wellbeingfestival.live, and plenty of activities and resources on there. And we've also got a calendar of events over the rest of the week, which you can see I've just put up on the screen. So please do have a look if there's anything on there that takes your fancy over the week.
Alex, there's
Yes.
just another question come into the chat for Nat. Could you just kindly go through the Clare's Law again, Nat, for us?
Sure. So this is a scheme that gives any member of the public the right to ask the police if their partner may pose a risk to them. It's called Clare's Law after the landmark case that led to it. Claire was murdered by her boyfriend, who had a history of stalking and domestic violence. So that's where it came from. The scheme also allows a member of the public to make an inquiry into the partner of a close friend or family member. This doesn't replace CRBs or DBSs or whatever, or, freedom of information requests, but it's really important to know that it's there. And if you have a suspicion, you can quote Clare's Law in contacting the police. There is a specific form. If you go on the internet, type in Clare's Law, it will come up and it will show you the form you need to complete before you email it into the police for them to respond to you.
Thank you. Thanks, Nat. Sorry, Alex, I thought that was just an important one to raise.
Sure.
Lovely, thank you. In terms of Clare's Law, now just another question. Do you know if those checks get stored anywhere? So would there be a record that you requested that information?
That I couldn't tell you. I think there was something commented about finding out if somebody had done a search on you. I know that was discussed, but I don't remember the outcome of it. I think the person who's doing the requesting is protected.
I'm sure if you were to go online to look for Clare's Law,
but
sure
yeah, I would check that online.
Yeah, lovely. Thank you. Great. Well, thank you all for joining us today. Like a lot of people have said, there's a lot of, it's hard hitting, but it is things that we need to be talking about, unfortunately, and particularly as females. So thank you very much, Nat, for your time, and thank you everybody for joining us today, and enjoy the rest of your afternoon and the rest of this week's activities.
Thank you very much.
Thank you.